Hello, everyone. It's Dr. Erkeda, and I am here with another fantastic Health Tech Highlight guest, Dr. Brittany Busse. And we're going to just have a great conversation about all of the good things that her organization is doing. And for our physician listeners out there, just like how we could potentially help you figure out what you want to do. So, I just want to give you a moment to just share a few words about you and what you do.
Of course. Thanks for having me, Erkeda. That's always fun for me to chat with other doctors about what I'm doing and why. I started out as a surgical resident actually here in Northern California. I'm in the Sacramento area. And after a few years of training, I had some issues with my vision. I ended up having surgery and just separating from my program. And at that point, I had no idea what I was going to do, right? Like, I was like, okay, what do you do when you just end your program and suddenly you're kind of left flailing? So I started working at urgent care because that's really the only place that would take a non-board certified doctor like me and give me some work to do. That was just mind-numbing work for me at that point. And I transitioned into telehealth in 2016. Again, I was really disappointed by the way that physicians were treated by large telehealth companies, like really overworked, undervalued for our experience and everything that we contribute to those companies. And we were really treated as just like not that important, to be honest, when their entire business model is based on our ability to do the work. So in 2021, I decided that I wanted to create a company that would help physicians launch their own telehealth practices. Like, why should Teladoc and Amwell and some of these other platforms have the ability to just profit off of our expertise? We are the ones who own the expertise, who own the credential, and it should be just way simpler for us to start our own telehealth practices and meet patients where they are, and also way more cost effective. So I've spent the last 3 years just looking at ways to help doctors come together and start independent practices, but not feel like they're launching alone and in a vacuum where they can't be seen or heard. So when I created the physician cooperative, it's really just to help physicians take advantage of the benefits of group practice while still fully maintaining their own autonomy and independence and authority within their practice, but getting the benefits of group costs as well as networking with other physicians so that we are always independent but not alone.
I love that. And I feel as though you brought up a lot of key points with your story. I think with both of us, just being pretty active on LinkedIn, a
Mhm.
lot of our connections are physicians or leaders in healthcare. And some of the issues that we don't highlight enough are how you can go all the way through med school and do this intense training, and a lot of us get a lot of debt and all of the different things. And there are laws and all of these things that prohibit us from practicing medicine when we have an MD and all of this knowledge, despite even passing certain exams and stuff like that. And if you don't complete your intern year residency, well, if you complete your intern year residency, you can be licensed to work in like an urgent care and things like that. But if you don't get your board certification, it sometimes prohibits us from going to practice. Whereas in some other professions, it isn't as restrictive, and it can
Mhm.
sometimes leave physicians to be crippled and not necessarily know where to go next. I know I had a friend who had a similar thing going on, and he was able to work in urgent care, and then he had to go and find another residency and all of these different things. But we definitely have to, number one, work on providing different avenues for physicians. Once you graduate, you're a physician. So, what avenue you want to take? Of course, residency is important and training and all of those things, but sometimes people may want to take another route.
Mhm.
So, we need to do things in order to do that. We also have a lot of physicians who may graduate and not have a residency
Right.
position open because there are so many medical schools opening, which is wonderful because we are having a workforce like shortage, but
Mhm.
we don't have the amount of positions open to match that. So some people may may graduate and never match into a position, or it may take a few tries. So that's a whole nother conversation, which we may hit.
I mean, I talk to a lot of physicians who are obviously, like I said, because of my background, people reach out to me. They're like, I'm not board certified, I'm not board eligible. And honestly, one of the main things there that is, I don't know, I originally saw it as like a detriment to me, like, oh, I'm not board certified, and like I was less than as a doctor because I didn't have like, what kind of doctor were you? Like, it was always kind of a sensitive question people would ask me. Like, I'd say, like, what do you do? I'm a doctor. What kind of doctor? Oh, well, I'm just a doctor, but like, just a doctor is still a doctor to most people, like lay people. They're not asking you to like prove your credentials or prove your worth. They're just making conversation. But that was just a really sensitive area for me for a long time. And so because of that, a lot of people reach out to me when they're having issues with residencies or having issues with lack of the match. And there's a lot of different opportunities for doctors. And sadly, there are so many good doctors out there who aren't able to continue their training. So it is a goal of ours to keep looking at ways to expand things like assistant physician programs, which are offered in some states where the doctors actually apprentice in a old school kind of model in order to achieve their licensing. And I think that should be a viable option, especially in primary care, where doctors can practice just like nurse practitioners and physician assistants do, to practice their skills and gain the knowledge they need to be comfortable working on their own out in a real practice. And so the main drawbacks that actually ended up being liberating for me are, I can't contract with insurance companies. Oh, darn. And I can't go get beaten up at a hospital. Oh, so sad for me. But like I said, most patients, they don't care. They want to know, are you a doctor? Do you want to take care of them? Do you possess the necessary skills and qualifications to provide good care? And if you can meet those criteria, then you absolutely are worthy. You should be out there helping patients because this is what you were called to do.
I love that. And I love that you mentioned that, yes, some people may go the more traditional route. And when you get into these environments, it may be less than welcoming. It may not allow you to work to the top of your license that you want to work at. It may be more administrative. It may be more abuse and less autonomy in terms of your career. So, how does your business work in terms of the cooperative business model, and how can it be more beneficial than working for the traditional system?
Yeah, so really, our cooperative model is built around a professional corporation. So, what you'll notice with a lot of physician groups or physician networking type sites, it's pretty traditional corporate status, or they might be like a nonprofit. I specifically started a professional corporation or a medical group because that allows us to purchase things as a medical group does. So, things like malpractice insurance, and we can have group policies, we can have group purchasing. All of those things are available to us as a professional organization that is established within the state of California, as well as a couple other states. And we are growing that number pretty daily at this point. Like, as the physicians join, we usually get certified in their state to operate our corporation so that they know that they have the protection of the corporate entity, no matter where they're practicing. So what that allows for physicians, which is different than, let's say, a traditional medical group, because I've been a medical director at a bunch of different companies, is that we very specifically say in our contract for our members is that I'm not going to get involved in your practice. What you want to charge patients, the hours you want to work, what kind of care you want to deliver. I'm not going to audit your charts. Like, it's really up to you to determine the type of service that you're bringing to patients. And it's going to be up to the patients whether or not they want to see you, right? So it's very different than a medical group where we're assigning patients to people, where we're having to follow up on all the charting that you do. Like, this is a fully autonomous and independent practice. Like I said, just within this group structure, so that you can take advantage of the benefits of networking with other doctors, of referrals within the group, of purchasing your malpractice through our group policy. All of those things are really helpful for doctors. So instead of 10 doctors who are independent, each paying, upwards of $10,000 or more a year for malpractice insurance, they can join a medical group and take advantage of the cheaper rates that we're able to get to each individual doctor under our group practice policy. So it's a great model for any doctor who's looking to save money on malpractice and to network and to refer patients and get referrals from other doctors.
I love that. I had honestly, am aware of PC models just because there are a lot of friendly PC partnerships that go along in health tech, and when you have 49, 50 licenses, people reach out to you about those things. But it's very interesting to kind of see it kind of in like this practice model
Mhm.
where physicians can come together and they can have autonomy over their practice, but still practice as a group.
Mhm.
So I think that that can be very beneficial where people are able to determine what their schedule looks like, what patient panel, what size they want to have it, what they want it to look like, and then also just kind of bring back that joy into medicine. I know earlier you mentioned how when you were practicing urgent care, you weren't necessarily feeling excited about it. You found telemedicine. Can you tell us about the biggest difference you've seen in practicing traditional medicine versus telemedicine?
Sure. I think, for me, it was very much like moving from a model where I initially felt like I didn't have that much control over, seeing patients again. Like you're in an urgent care, this one's open 12 hours, but that means you're seeing patients well past the close time just because they all decide to come in like 5 minutes before they close, just like at a restaurant. I have lots of experience as a waitress too. So I was like, oh, it's just like a restaurant. 5 minutes before close, everybody shows up. And then moving into a telehealth model, I thought I would at least maybe have some more flexibility in where I practiced. I had a kind of a funny mindset going into it. It was like, okay, if I'm going to be used and abused by a system, at least I could do it from the beach, you know? Like I really just wanted more freedom in my ability to practice from different locations. So if I wanted to travel or I wanted to have a different schedule, but honestly, in working for corporations, I didn't find that that was really true, right? Like you didn't have the flexibility and autonomy that you thought that you were going to have. Um, and the corporation, at least the one that I worked for, like they just didn't have any respect for the doctors. Like they were like, the CEO would often say, the doctors are like Uber drivers and
Mm.
they should just be put on a patient call whenever it's convenient for me. It's like, yeah, except for let's say 90+% of the US population owns at least one car, and less than 1% of the US population has a medical license. So, no, doctors are not like Uber drivers. Like, we should not be treated like Uber drivers. Like, the great thing about doctors is that we are able to develop amazing relationships with patients. And where we saw telehealth going was as a continuity of care model, right? Like having the ability of one doctor to be licensed in multiple states and then to care for patients across the care continuum throughout the life of that patient. Whereas most of the telehealth companies were taking the same approach where they are like, well, this patient called in for a cold, so we're going to go have them see, Dr. Erkeda, and then they call back in 2 weeks because now they think they have a sinus infection. Well, then they're going to see Dr. Busse. And it just wasn't satisfying for the doctors or for the patients. Right. So you wanted to have this more advanced model. And I think SteadyMD attempted to do that for a while where that's why it was called SteadyMD. Like they wanted the same doctor to be able to see the patients regularly and to develop those relationships for them. It's a model we tried to create in workers' comp, occupational health, where I was the primary treating physician for these patients and I could see them across the care continuum. Really, the main difference was the ease of access for patients, as well as the the ability of me to treat patients who were not geographically close to me at all. Like I was treating patients all over the state of California, in Hawaii, in Washington, and those patients were all able to get a very comprehensive and standard level of care, whereas if they had just taken their injury and gone to whatever urgent care is closest to them, they wouldn't have had like a standardized care. So it was really important for employers that we worked with to be able to know, like, no matter where their employee was located, they were going to get the same great care according to the same care guidelines, rather than just kind of luck of the draw, whatever physician's available or PA or NP in the urgent care that way. So there's kind of another benefit of having this cooperative practice is that larger employers need more doctors, right? And they need doctors across diverse geographical regions. And so it really gives us the opportunity to create this independent physician model and to create a very large group of doctors and start to negotiate these contracts where we can be supporting larger and larger employer groups.
I love that. As someone who is a digital health risk management consultant and has worked in telehealth for years, it's been very interesting, and it's things that I think about when you're thinking about the models and how we're evolving over time. So actually, there were a lot of startups that came onto the scene who were trying to do more touch base, urgent care type medicine. Let me treat your cold. Let me do this. Then there were some who were thinking about doing primary care or chronic care where you are having the same doctor and all of these things. But then there are the nuances that a lot of, since this is a health tech podcast type thing, where you're thinking about how to sustain those models, how to hire those employees. Do you want to hire an entire team, or do you want to have people who are coming in who are contracted? Do you want to give them a salary, or do you want to pay them per patient? It kind of goes into some of the discussion you were having about respecting the knowledge and the profession of physicians, in terms of people have studied for over a decade and you want to pay them $10 a patient. Number one, that is not a way to sustain life. Does it help with the safety of a patient because you're incentivized to see them quickly and not look through as much things? And how are you going to retain people? So that big drop off. So these are questions that organizations need to think about when they're thinking about what type of model they're doing. And then the fragmented care, in terms of, are you only going to see one body system? A person is composed of more than just one specific area. So that can work really great in certain realms. As we know, we have specialists who only see ear, nose, and throat, or only see eyes and things. But when you're bringing healthcare and you're trying to digitize it and you're trying to create this digital transformation, we have opportunities where we can kind of help move healthcare along. So these are a lot of thoughts that I think that people are having, and I love that you guys are creating a way to partner with employees to kind of reimagine chronic care management and serve as adjunct to the in-person care, which we all know that telemedicine isn't replacing any in-person care. Like, we can't reach out and touch you, but it is opening up different avenues to expand access and to allow for more of the lower hanging fruit to kind of come along, and you to be able to take care of that, and for you to take care of a patient in their vulnerable states or across a continuum, where you're not only treating their diabetes at one moment in time, but you can see them in their room and say, hey, let me see your fridge. And you'll see what they're cleaning, what they're eating, and kind of reinforce that. So there are so many opportunities. And I love that your group is able to kind of tackle that in the way that they are trained to and that they know will work best for patients.
Yeah, I think it's so important to understand that when medicine is relational, when it's relationship based, the physician is able to make those determinations that you're talking about, right? Like, if I know a patient really well and that patient wants to access me by text message, and they just need a medication for a UTI, like, that is something I am more than comfortable to help them with, right? Because I know them. I know that they know when they're getting a UTI. I know they have a history of UTIs. Like I know all those things about them that make me feel very comfortable allowing them to access care in that way. Whereas when you're a doctor working for a health system, like even if you have that relationship with the patient and they send you the my chart message or whatever, the health systems will be like, no, you have to bring them in for a visit because we have to be able to bill for this, and that's what I love about these new like membership based models that you see a lot of physicians using. Because again, it's very much what the telehealth companies are doing for their clients, right? Like they're saying, we're going to charge you per employee per month for this service. And the patients can access it whenever they need it. And they can have that experience of having a doctor on call. Well, in this case, you have the benefits of both the relationship with the patient and having the doctor on call. And the doctor can figure out when and which tool to use, right? Because if telehealth is just a tool, whether it's asynchronous texting, emailing, having a one-on-one video conversation, or referring that patient for in-person care, whether you're able to provide it yourself or you have connections in that area of geography where the patient can go and be seen for an in-person visit, like those aspects are all really important. And we need to look at how we create these nets of care that kind of wrap around patients and wrap around individuals so that we can always feel comfortable providing the level of care that's appropriate to the patient without the patient defaulting to, well, I guess I got to go to the emergency room because my doctor can't see me and teledoc can't help me and I don't know what else to do, right? Like that's where the patients are going to get their care. As far as like continuum of care, chronic management, we can definitely get into more detail on that. Like when you're treating a diabetic patient, like the old way of doing it or a hypertensive patient was they'd come in with their notebook full of readings for like the last 6 months and you're expected to like read that right there in front of them in real time and like tell them what is the trend and then make your medication adjustments based on that. And where we're at in this new era of digital health is like we can have patients monitoring their vital signs from home, receiving that information in real time and monitoring those trends, and also having our partners in care who can contact the patient when their trend is, suboptimal, if they're trending up on their blood pressure or their blood sugar, and help them make lifestyle adjustments in real time that are going to help them bring their health back into alignment without necessarily having to add more meds. So I think that patients and physicians need to understand that like telehealth is expanding way beyond just, synchronous and asynchronous visits to this full care continuum where we can be constantly receiving data about the health of our patients. So we look at that as people used to think health is something that happens in the doctor's office, right? Like I go to the doctor's office and this magical thing appears called my blood pressure. And the doctor tells me if it's high or low and if I need to be on medication for it. Or they, take a lab and it tells me if my hemoglobin A1C is up or down. And that's the only time I have to think about it. And like every other time, I'm just taking my meds, drinking Coca-Cola, and eating McDonald's and just waiting for my next doctor's appointment, but it's health is happening every day. Those daily choices that you're making are actually affecting your blood pressure, which is something that's happening in real time. So when patients can actually see that data, like, oh man, like my diet really is affecting my blood pressure and my blood sugar every day. Like now I can see the numbers and I can see how making a different choice impacts those numbers. Like they're a lot more motivated to make the very small changes that they need to make rather than when they talk to the doctor and they're like, okay, like do these 20 things and I'm going to see you again in 6 months. And the patient walks out and they're like, that's too much. I'm not going to do any of that. I'll see you later. And they come back in 6 months and they're worse, if not the same, like than they were 6 months ago. So it's just so much available to us in this technology era that we're in right now.
I love that because as we know, like the CDC even says that 80% of your healthcare happens outside of the healthcare system. So now we are working on ways to kind of bring healthcare to the home, bring it to the environment, bring it to the neighborhood, and have it integrated into their life. Do you or your team, do you guys have any ways that you are able to support primary care practices or employers with like remote patient monitoring or the chronic care management?
Yeah, so we talk about ViTel Health in like two different arenas, right? So we talked about the physician cooperative, that's our medical group. And then there's ViTel Health, a technology company. And as a technology company, we are very focused on remote monitoring and chronic care management. And when my partner came to me with the idea to integrate these services into our offerings, I looked into it and I was like, the thing that bothers me about remote monitoring and chronic care management is that they're looking at the vital signs and a nurse is just like calling the patients being like, you took your vital signs today, right? And like nobody is really making a difference in the health or lifestyle of these patients. Like, I love nurses, but like us doctors, they're not well trained, most of them at least, in lifestyle modification, right? And like there are some of us doctors who are really interested in that, who work with American College of Lifestyle Medicine or functional medicine, integrative medicine, and are looking at ways to help our patients live healthier on a day-to-day basis. So I said, if we're going to do this, we're going to hire certified health coaches, because the coaches can talk to the patients in a way that makes sense to them. I want these coaches to be from the communities where the patients are living, so that we are covering the social determinants of health really well. The last thing I need is a, health coach in San Diego telling somebody in Detroit, Michigan, like how to live healthier. And so I really wanted to make sure that our coaches had a good understanding of the challenges that the patients would face in implementing behavioral changes in their life. And we've had great success with this program. Like patients really feel connected again, not only to their health, but to their doctor. So many of these elderly patients had at one time had a relationship probably with a family medicine doctor or an internal medicine doctor who took care of them. And then those doctors all got absorbed by health systems and they lost that relationship that they had with their doctor. And they felt really disenfranchised and disconnected from the healthcare system, and their care became more and more fragmented. So when a primary care physician reaches out to us and says, we want to use this remote patient monitoring and health coaching, it's really the health coach's goal to make the doctor seem more approachable, right? Like that the doctor is there. The doctor cares about your health so much that they're going to have this health coach reach out to you, every week, every other week, or every time your vital signs are not where they're supposed to be, and make sure that you are doing okay, and make sure that you're setting these health goals that are going to help you live healthier for longer. So our patients love their relationship with their health coach. In fact, like we had one patient who had her insurance change and she had to switch doctors to like a big box clinic from the clinic that she was going to. And the next time she could change her insurance, she changed back so that she could be with her health coach, because we weren't able to support her at the clinic that she went to, because I'm like, well, sorry, we don't work with them, So she's like, no, I have to change my insurance back because I miss working with my health coach so much that it's really important to me to stay with this doctor so that I can stay with this health coach. So it really offers an awesome opportunity for patients to feel healthier and feel more connected to healthcare. And it's a great opportunity for physicians to take advantage of these Medicare billing codes that are really important in the primary care physician world, where you're kind of struggling, right, to make ends meet just billing evaluation and management codes when your patients come in to be seen. This creates monthly recurring revenue. And we are very diligent and very cognizant of meeting the compliance guidelines set down by Medicare, so that we know that we are, providing the best care to the patients, but also staying in complete compliance with our billing, because it's so important for doctors to understand that these companies are using your MPI to bill Medicare. So if they're doing anything that is not kosher, I won't even use the big F word here, but if they're doing any of that, like that's going to fall back on you, not on the company. And so we've heard some horror stories just of doctors who have been signed up for these things. Their patients never received care, yet Medicare received months and months worth of bills for hundreds of thousands of dollars for these patients that were supposedly being cared for. And, so far I haven't heard of a doctor who got under investigation from OIG, but I think it's only a matter of time. So if you're a doctor, we want to balance like the risks of using the wrong program with missing out on the opportunity to help patients and also earn additional revenue. So really do your due diligence on companies. Know that ViTel Health is here to support you as a physician-owned and founded company who understands that happy physicians equals healthy patients.
That's so important. And you mentioned so many great things with that. I think number one is for the physicians out there, definitely look and see who you're partnering with. Sometimes you didn't want to mention the F word, but I will since I'm healthcare risk manager. Fraud is real. And there are doctors who go to jail, and you don't want to do that because everything kind of falls back on your license. So you have to make sure that you're partnering with groups that have your best interest at heart, and that you not only is your organization staying up to date with all of the new regulations that are out there, but you're also educating yourself. So there are mechanisms in place, and especially with the utilization and the implementation of a lot of things in digital health, including AI, the rules are changing. So definitely stay up to date with those, and there are organizations, some like mine and others, that can help you navigate that. But outside of that, I think that another thing that you mentioned was like vetting your vendors. That's very important to make sure that they're in alignment not only with your mission and the patients that you want to serve, but also that their platforms and things that they are using in their technologies are compliant, that you have secure. We've seen like with United Healthcare, all of the drama that's going on with the ransomware, unfortunately. We've seen all of these different things. So just definitely vet your vendors. And going back to the patient, because that's one of the most important things. I love how you mentioned about like offering these chronic care services that wrap around, and they allow not only the physicians and the other clinicians on the team to work at the top of their licenses and care for patients, but it continues outside of that. So you have your health coach, and you're not only doing this to hit like certain milestones or metrics, but you're actually like changing patients' lives to the point where they want to come back if they change their insurance. So it's being effective, and it's helping to improve outcomes. So that is amazing.
Yeah, I'm really proud of our health coaching team, honestly. Like I could not do it without them. They are a lifeline for patients and for the doctors that they work with. I think I hear all the time from the doctors like, wow, my health coach is amazing. They keep me informed, and our patients have such a great relationship with them. Like we're just so thankful that you have these team members. And hiring can be difficult, but so far we've managed to do a good job matching physicians, patients, and coaches who are really dedicated to patient wellness. And again, that just helps us meet our goals every month, because if you're looking at most of these CPT codes are time-based, and you could record that time in any number of ways, but our coaches are actually spending the time in coaching visits, talking to patients and counseling them about their lifestyle. Like that, I think, is the best way to spend those 60 minutes every month that you're going to get reimbursed for.
Absolutely. I feel like we just could talk for hours about all of this interesting stuff, because it's just growing and evolving so fast, and there's so many different ways in which we can impact healthcare, but also impact those who are delivering the care, and making sure that it is a place where they feel welcome, where they feel valued, and where they can create the impact that they choose to create. So for you, for my final question, where do you see the biggest opportunities for impact in the intersection of healthcare and technology, especially considering this changing landscape?
Yeah, that's a good question. I think that, we know that these RPM CCM technologies are just being way underutilized by doctors. And it comes down to, like we both talked about, like risk management, right? I think there are certain specialties of doctors that we find are less risk averse, like cardiologists, and they're the ones who are actually predominantly taking advantage of this billing, but they got all their procedure codes. Like primary care doctors tend to be more risk averse, but they're the ones who really need to be on the front lines, which they already are. and having this information at their fingertips and at their disposal for managing these chronically ill patients, and to really have the support, because their job is so time intensive, is so relationship intensive, and they need the support of groups like ours who can help them manage their administrative burden and still get paid well for the work that they're already doing. Because let's be honest, like, family medicine doctors, internal medicine doctors are doing a lot of work and they are just not being compensated appropriately. So anytime we can find avenues like this to support doctors, to help them improve their compensation so that they can stay open, they can stay independent, like, that is really my passion, is just helping them not just survive but thrive in their independent practice.
I love that. And for everyone who may be watching this now, um, we appreciate it. For those who may be watching it later, we know it's different times all over the nation and it's live. You may be at work, you may be going to make dinner, all of the things. So it'll be still live, well, still present on LinkedIn. And I'm also going to post it on the YouTube channel for Digital Risk Compliance Solutions. And I'll be back with another fantastic guest in a few weeks. I think my next episode is on June 25th with John White from WebMD. And I'm just going to let you close us out by just telling everybody goodbye. I've put where to find ViTel Health in the chat. So if you guys want to go and look it up, if you want to join, or if you have an organization that you want to partner with, just reach out.
Yeah, for sure. It was great talking with you today, and anyone can reach out to me anytime on LinkedIn. That is where I am most active. I'm not much of like a Twitter user, Facebook user, any of that stuff. So if you want to, just shoot me a DM anytime. I'm always happy to talk about both the cooperative practice as well as the RPM CCM solutions. Like I said, shoot me a DM. I will put you on my calendar and we will sit down and have a chat about how I can help you.
Awesome. See you guys soon.
Thanks.